Welcome to poster presentation on exploring self-reliance in primary healthcare among families using traditional medicine in southern India, a phenomenological study. Little bit background about the study. Approximately 80% of people use traditional medicine in low and middle income countries due to their low cost, easy accessibility, cultural and religious preference. Same like that in India also, in southern India, especially in states like Kerala, Tamil Nadu, Karnataka, there is a huge usage of traditional medicine for primary health care. In Mysore district, in taluka called SD Kote, many families practice traditional medicine for primary health care, contributing to primary health care of the region. Self-reliance has been spoken in the context of primary health care ever since Alma-Ata Declaration, or even before that as well. But there is ambiguity in the conceptualization and clarity of the concept, what it means and how it can be emerged. And also, there seems to be no empirical studies conducted to capture the meaning of self-reliance in the context of primary health care. Since traditional medicine often claim self-reliance in their interventions, we believe that traditional medicine interventions provide an opportunity to explore the factors that influence the emergence of self-reliance in primary healthcare among families using traditional medicine. We conducted this study in HD Kote, a taluka in Mysore district, southern India, considering the usage of traditional medicine in a huge in the region. We adopted a case study method using a phenomenological approach in the study, and we selected the participants through an organization called Foundation for Revitalization of Local Health Traditions, which earlier conducted a study on documentation of local health practices in the region, which provided the list of households practicing traditional medicine. We selected the information-rich cases using purposive sampling method, and we arrived at adequate number of sampling using replication logic that is being used in case study method. We collected the data using in-depth interviews and focus and observation of the context. The ethical clearance was obtained from the University of Transdisciplinary Health Sciences and Technology, Bangalore. Our study found that participants were able to practice traditional medicine at primary care level for common health ailments like fever, cough, cold, dysentery, etc. This reduced the health expenses related to these ailments, contributing to primary health care because they were practicing at the household and community level. They reduced the visiting to the hospital for their common health conditions through the use of traditional medicine. However, we also found that there were some harmful practices like denial of care and superstitious beliefs, which needs to be addressed through proper education. We also found that local resources, knowledge, and cultural values hugely contributed to their health decisions, which influenced the emergence of self-reliance. Hence, our study found that self-reliance is a complex notion which emerges from the interaction of various factors, not one factor. At multiple levels, at macro and micro level, there are various factors that interact together in the emergence of self-reliance. Hence, we conclude that mere making of accessibility of resources doesn't result in the emergence of self-reliance, as there is an interaction of various factors like lifestyle factors, policy factors, health system factors, and also agency and structural factors. Therefore, self-care, which is a precursor for self-reliance, should be practiced having an adequate knowledge and information. Otherwise, there will be continued delay in the care, which doesn't result in the self-reliance for primary health care. The growing importance of pluralistic healthcare and the need for making choices between them is immense, in the direction of which self-reliance hugely contributes if it understood and applied correctly. COVID-19 pandemic also emphasized a lot on health behavior and individual responsibility, which is nothing but self-reliance as a value to be adopted at the individual level. Hence, the need for incorporating self-reliance as a strategy is immense in the context of health policy and practice. That's how we conclude from the study. I acknowledge all the people that we contributed to the study, Prashant, Uni Krishnan, and also ICMR for the fellowship, Friends of Hope Trust,
Swami Vivekananda Movement Organization, and also all my study participants for their valuable time. Thank you so much.